Thank you, Patty. Thanks, Patty. I appreciate you and Roxana and the entire team here at WellSpan. This is an outstanding healthcare institution, and I enjoy the important work you do in the healthcare space. And I also want you to know your CEO, Roxana, sits on numerous important economic development boards across our Commonwealth and does really, really important, valuable work for this institution and the entire region. So thank you. It's good to be with you. I want to say how cool it is for me to be here with all of these RNs. I want you to know that I had hoped as I was growing up to be a doctor like my dad. Apparently you have to take organic chemistry and calculus and things like that. Obviously didn't work out for me, but some of my earliest memories are as a little boy, maybe 5, 6 years old, making rounds with my dad, which I thought was the coolest thing in the world. I got to spend time with my dad. My dad's a pediatrician. He would always go in for a C-section. Thank God I didn't know what a C-section was. When I was making rounds with him then, I probably wouldn't have wanted to go back. But I remember vividly every different hall we would walk down, room we would walk in, my dad would point out who the nurses were and tell me, they're the ones who are really in charge of the place. No offense, Roxana, but I think everybody knows how valuable and important nurses are. We also know that we need more nurses in Pennsylvania, which is in part what brings us here today. So I'm honored you would spend some time with me. Thank you very much, and thanks for the work you do for patients every day. It's good to be back in York County. It's good to see my friend Commissioner Hoke, and it's good to be here to cite yet another example of how our administration is cutting red tape and advancing freedom, in this case, for our healthcare workers all across our Commonwealth. And we're proud to use WellSpan as the place where we are announcing this initiative because of how much foresight they have in numerous initiatives to create more opportunities for healthcare workers in Pennsylvania. As of today, after a whole lot of work by a whole lot of people, Pennsylvania, I'm here to announce today, is now a full participant in 3 multi-state licensure compacts that allow doctors and nurses and physical therapists to quickly and easily get licensed to practice now in dozens of states. This is something that folks in Harrisburg, folks in our state capital have been talking about and trying to accomplish for years. Representative Burns, who you'll hear from in a moment, the chairman of the committee with oversight on this, and by the way, a state representative from the Johnstown area, but is here today in York because of just how important this issue is. I believe he voted on this issue about 9 years ago in the House of Representatives. And I'm proud that under Secretary Al Schmidt's leadership, my administration finally, after many years, got it done. Let me explain why this is important. Here in Pennsylvania, we are facing significant shortages of healthcare professionals, especially in our rural communities. In urban counties across Pennsylvania, there is 1 primary care physician for every 222 residents. In our rural communities, there is 1 primary care physician for every 522 residents. More than 850,000 of our neighbors in Pennsylvania live in communities that do not have enough health care providers, according to the federal government. Statewide, today, 14% of nursing jobs are vacant. And in rural communities, that percentage of unfilled nursing jobs jumps to 26%. That's 1 in 4 in those rural areas. And unfortunately, the challenge is only getting worse. By 2026, we're expected to have a shortage of 20,000 nurses in our hospitals. So today, as just one way to be able to combat this, we're making it easier for qualified medical professionals from dozens of states to now provide care right here in the Commonwealth of Pennsylvania. We are doing that by cutting red tape, speeding up licensure times, as you heard from Patty a moment ago, and making it easier for qualified medical professionals to get to work in our hospitals and clinics and in our doctors' offices right away. From day one, my administration has been serious about cutting red tape and making government work more quickly. In my first week in office, I signed an executive order to overhaul the process of reviewing our permits, licenses, and certifications like those that doctors, nurses, and physical therapists are required in order to do their jobs in Pennsylvania. As a result of that executive order, we aggressively reformed our permitting process. We sped up government, we slashed wait times, we removed backlogs, and we finally are fixing our permitting processes after all these years of neglect. We went from the bottom of the pack on occupational licensing to one of the best states in the nation. The wait time for a registered nurse and licensed practical nurse license went from 25 days to just 5 days. You heard before, but it bears repeating. Physician licenses went from taking 43 days to about 5. Physical therapist licenses went from 31 days to about 3. To get a pharmacist license went from 26 days to 5. And let me tell you, with as hard as Al Schmidt works, we're not satisfied with those numbers. We're going to continue to make progress, and we're incredibly proud of all the team at the Department of State has done to speed up those times. Now a trained nurse or doctor or physical therapist can not only get their license faster, it means they can also get on the job treating patients far more quickly. Joining these medical compacts, as we are announcing here today, doubles down. What do you think? Is it doubles down or double downs? Yeah, we'll just say double down, Roxana said, okay? We're doubling down on that progress. Folks who are fully trained and licensed and live in another state can practice in Pennsylvania with ease now. And if you decide to move here to Pennsylvania, you can use a fast, streamlined process to transfer your license to our Commonwealth. So now a nurse like Hollis King, who you'll hear from in just a moment, who lives just across the border in Maryland, though we're already working on getting her here to Pennsylvania, can more easily and quickly get a job here in York County with WellSpan. We're creating more job opportunities for her and thousands of nurses like her and helping WellSpan compete for talent. Imagine a doctor, for example, who was born and raised here in Pennsylvania, but then went to college and medical school out of state, got licensed, say, in Illinois or New Jersey or Colorado, or one of the other states that are involved in this compact. Now, when she wants to come home and live and work closer to her family and community that raised her, she can do so with ease. Thanks to this compact, she can do that faster and more easily. Previously, even though she was licensed in another state, she'd have to go through our entire licensing process, which at times, depending upon the particular specialty, could take upwards of 4 or 5 months, depending again on that area of practice. Now, that out-of-state license that's part of that compact will be recognized within just days here in Pennsylvania. And that is going to allow that physician to be able to get to the bedside far more quickly. My administration is working to expand our healthcare workforce and address these critical shortages so more Pennsylvanians can get the care that they need, care that they deserve in the community where they live. We're, of course, doing that by cutting red tape, and we're doing that now by this compact and looking in the out years, looking into the future, doing that by investing through our state budget process. Way back in February, I proposed 2 key steps to expand our healthcare workforce as part of my annual state budget. First, I want to create a new loan repayment program specifically focused on healthcare professionals who take jobs in our rural communities. My budget would help pay off student loan debt for doctors and nurses who agree to serve at least 2 years in a rural community. Second, my budget strengthens partnerships between hospitals and nurse education programs that guarantee nursing student jobs once they graduate. Let me explain how this works and another reason why I'm here at WellSpan today. Hospitals know that they need more nurses, so they partner with local nurse education programs to offer guaranteed job placements to nurses after they graduate. Hospitals get a guaranteed workforce of trained nurses that they can rely on to fill their jobs. And nursing students, well, they get the peace of mind knowing that they will have a guaranteed job upon graduation and receive help covering their tuition in the meantime. Altogether, our communities get a much stronger pipeline of well-trained nurses taking jobs in local hospitals and the communities that they love. WellSpan knows the importance of training great nurses in our communities and helping them get jobs in our communities once they are fully trained. That's exactly what they're doing here at WellSpan Education Center. My budget will help more communities build the kind of partnerships that exist here at WellSpan and cut the costs for nursing students while making communities healthier and giving them a pipeline to opportunity right here in the Commonwealth of Pennsylvania. Right now, Representative Burns and his colleagues in the General Assembly are considering that budget that I announced about 150 days ago. I am grateful for Representative Burns's support. You know, here in Pennsylvania, we are one of the only states in the nation with a divided legislature, where the Democrats control the House and the Republicans control the Senate. That means that no one gets everything they want, and the name of the game is compromise in order to get big things done. We've done that over the last 2 years, working together, Democrats and Republicans alike, to make strides in workforce, make strides in the education, make strides on public safety, and of course on economic development. I'm confident that we'll be able to do that again. My team and I are actively engaged with the leadership of the House and the Senate. While everybody was at the beach or spending their time at barbecues this weekend, we were pouring through the state budget. And I want to thank my team and the team from the Senate and the House for all of their hard work over the weekend to make sure that we're advancing important causes like this, to make sure that we have more nurses across this Commonwealth, particularly in our rural communities, and to work on so many other important initiatives to the future health and success of our Commonwealth. We're going to continue in my administration to speed up government, to cut through the red tape, to make government easier for people to work through in order to achieve their dreams right here in the Commonwealth of Pennsylvania. The person who leads that effort for us, who makes sure that we are able to cut through the red tape and speed up government, is the person in charge of signing all these licenses, by the way. This is the guy you really want to know. And that is Secretary Al Schmidt, the Secretary of our Commonwealth. And it's my pleasure to invite him up now for a few remarks. Secretary Schmidt.